Hi everyone, myself is Tivida Shanmugam and today me and my group members going to present a role play that is related to lost patient record. So myself is Tivida, acts as a doctor, my friend Ilmi acts as a patient family, Yasmin as a narrator, Marsha as a nurse, Amiza as another nurse, Yusuf as a patient, Yalni as a pathologist and Shidan as a surgeon.
In one fine day, a 40-year-old man brings his 19-year-old son to the hospital with stomach pain for the past few weeks. The patient was really in pain as he requested immediate treatment from the doctors. Unfortunately, they cannot do it as the hospital is full of patients at that time, and the appointment made by the patient on that day is fully booked. Mr. Yusuf's family does not want to give up and try to contact another nurse as he desperately needs a doctor to check on him. The family members tracked down this one nurse and approached her for assistance.
Hi, nurse. Good afternoon. I would like to make a doctor's appointment for my son here.
Good afternoon. Your son's name?
His name is Yusuf, and he has been having severe stomach pain for the past few weeks. And I would be happy if you can help us get the appointment as soon as possible.
I don't think so. You can get an appointment soon since we have lots of patients in this hospital. You may refer to other hospitals if you want.
I hope you can understand my situation, nurse. I'm really in a hurry.
Just give me your details and I'll try to fix an appointment for you in a week maybe, but I can't guarantee you. And it may take longer than that. Plus, you don't look like you're in pain. If you are really that sick, you wouldn't be able to talk to me. Instead, you would have been in the emergency room, lying down on the bed.
I can't believe it. How could you even say that? My son is in extreme pain, and this is how you deal with the patient, miss?
Nurse Amiza tries to reach the doctor in charge of this case immediately.
Hi, Dr. Tivata. I have this one patient and his dad who urgently need your help. Do you have time?
Hi, Miss Emiza. Yes, sure. I don't really have a lot of patients right now, so you can call them to come here.
Okay, Dr. Tivata. Thank you.
Knock, knock. May I come in, doctor?
Hi, sir. Come in. Myself, Dr. Tiveda, and I'm in charge of your checkup today.
Hi, Dr. Tibaita. It's really nice to meet you.
Yes, sir. How may I help you today?
I've been having terrible stomach pain for the past few weeks.
Oh, I see. Is this the first time you're referring to a doctor?
No, doctor. I actually came to this hospital this morning, and the nurse who was in charge at the counter was so rude. And she was mean to me and my dad. Her name is Marsha. I saw her name tag.
Oh, I see. I'm really sorry on behalf of the nurse. Let me get back to you in a while. Can you please be seated?
Sure, doctor.
As Dr. Tivaita asked the patient to take a seat, she called out and approached one of the nurses who was walking near her at that time.
Nurse, may I know who was in charge of the registration for the specific patient today?
Yes, doctor. What is the problem? That was me who was in charge in the morning.
Okay, I heard you have treated this patient very rudely. Is that how you treat a patient? You are supposed to handle the patients very politely. There are some rules and regulations in this hospital which you really need to follow, and you fail to do so. Hi, I'm so disappointed with you, nurse.
I'm really sorry, doctor. I was having some personal issues and I won't repeat this again.
Okay, I hope you don't repeat this mistake again. You may go now. So sir, how long have you been experiencing this pain? And is it like a shooting pain or how is it? Can you able to describe the pain, sir?
It's some sort of sudden pain that begins at the right side of my stomach, doctor.
Oh, okay. Sir, don't worry about it. I think I need to take a few tests, like a blood test on you in order to confirm your diagnosis. Is that okay, sir? Are you okay with it?
Yeah, sure. I'm okay with it, doctor.
All right, let me take a blood test on you.
The doctor took a blood test and sent it to the laboratory for the pathologist to evaluate and confirm the diagnosis.
Hi, doctor. This is patient blood sample.
Yes, thank you, Nurse Amza. Have you labeled the patient's name on the test tube? What's this case about?
Yes, I have labeled the test tube. It's about a patient who has been complaining about having severe stomach pain, and I think in my opinion, it could be a normal gastric pain.
Okay, Nurse Amja. Thank you. I'll evaluate the blood sample and get back to you.
Okay, doctor. Sure.
So based on the blood test, this patient has a high white blood cell count, which is a sign of infection. This patient might be having an inflamed appendix. We need to take an ultrasound and CT scan to confirm this as soon as possible.
Okay, doctor. I will get those tests done and we bring back the result to you as soon as possible.
After getting all those tests done, the nurse meets the pathologist again.
Doctor, I think you are right. This patient have an inflamed appendix. What should we do next, doctor?
I think we will have to perform an appendectomy immediately to prevent the rupture of the appendix and to keep the infection from spreading. Nurse, please alert the surgeon regarding this case. Before surgery, give the patient a dose of antibiotic to treat the infection.
Okay, thank you, doctor. I will alert the surgeon now.
Nurse Amiza's shift is over that day. She went and asked help from Nurse Masha to take over Mr. Yusuf's case.
Hi, Nurse Masha. My shift is over for today, and can you handle this case for this patient named Yusuf?
Okay, sure. Since nobody else can do it, I will take charge of the patient record.
Thank you, Masha. See you tomorrow. And please make sure to take care of this patient and his information. Also, please be nice to him.
Whatever. Okay, bye.
After Nurse Amiza went home, Nurse Masha took the time to watch drama on her phone while in her shift. She left the files of patient record over the counter with loads of other patients' records.
This drama is totally unrated, and I can't wait to watch another series. What should I do now? Was I given a task before? Wait, just now Nurse Amiza gave me something. Oh my god, the patient record. Where is it? Where did I put it? There's lots of patient records here. How do I find the record now? Oh my gosh, I am so much in trouble.
The surgeon team has prepared for the surgery, including Nurse Masha, and everyone is at the outside of the surgery room.
Hi everyone, I am Dr. Shidan and I will be performing the surgery appendectomy for the patient named Yusuf. So I will need the patient record right now.
Hi doctor, I'm the one who kept the patient record for this patient.
Okay, so where is the patient record? I need it now for me to perform this operation immediately to avoid the ruptures of his appendix.
I will bring it for you, doctor. It was on the counter. I forgot to bring it here.
Okay, please hurry, chop chop.
I'm sorry, doctor. I didn't know where I kept it. It was just here. I swear. Let me take a look for a moment. Give me 5 minutes.
How am I going to start this surgery without the patient's details?
I am so sorry, doctor. I promise not to repeat my mistakes again. I had some personal issues just now.
Come on, please be professionals. Please do not mix your personal issues with your work, okay? Now, how do you intend to fix this problem?
I will call Nurse Amiza for a while to help me find it. Okay, calling.
Yes, Nurse Masha.
Nurse Masha waiting for Nurse Amiza to come over to the hospital.
Hi, can you come over to the hospital and help me find the patient record that you gave me? I lost it over the counter.
How can you lose it? It is very high. It's very important. The patient needs immediate help.
Yes, I know. I won't do it again. Please help me.
Hi, Masha. I already told you to take care of it. How can you be clumsy and not notice where the document is? Never mind. I will try to look for it.
I'm sorry.
Here, I found it. It's just the same place I put it before I go back home. Take this and give it to the surgeon now.
Okay. Oh my god, thank you so much. Okay, I'm going now.
So, do you have the requested patient's detail that I asked for?
Yes, doctor, it's here. I'm very sorry for my negligence.
Yeah. Yes, you should be. You should take some time to get yourself back on track and come back here with proper preparations.
I totally agree with you, doctor. I will do as well.
All right, guys. Once again, we are going to perform the surgery. Please make sure everyone is ready and we will begin with the surgery.
Okay.